day and increase incidence of CKD in 30 years. This is the data which is showing that this is having a very, very bad impact on human beings. So this is the same. So this is the definition of CKD, which is with the proteinuria or albuminuria more than 30 milligram per gram and GFR less than 60. This is the and both of these are present for more than three months. What are the risk factors for CKD? These may be modifiable or non-modifiable, and diabetes is one of those. And you see these risk factors, and in diabetes, it is the prolonged, persistent, and uncontrolled diabetes, hypertension, obesity, dyslipidemia, all leads to diabetic nephropathy as far as these risk factors are concerned. So there are many studies coming out of it, but the nutshell is that it is dyslipidemia, hypertension, uncontrolled diabetes, obesity, and smoking, which is causing more and more prevalence of diabetic kidney disease. So this is again the uncontrolled diabetes and proteinuria. The main focus is pathology and pathogenesis. So the PGRs are definitely sitting over here. What is the main mechanism by virtue of which the diabetic kidney is here? Can anybody answer? Glomeruli are infected. And what is the other mechanism? Because diabetes is a one. So if you see that the dyslipidemia, microinflammation with hyperglycemia all lead to the metabolic the problem, hemodynamic problem, and inflammatory problem. All of these are going to give rise to the scarring in the kidney, and ultimately patient is suffering end-stage renal disease and will be put on dialysis. And if you don't discuss this triad, which is kidney, liver, and adiposity, it will also give you a picture that what is happening in the body when diabetes is there. All these mechanisms, if you are having in mind, what will be happening, what is the nutshell? So hemodynamic or inflammation or whatsoever, all the things are going to cause this scarring and the glomerular. What is that? It is causing the podocyte depletion. It is causing, this is the big mechanism, but just look at it. What is the ultimate? Then is the hypertrophy of the podocyte, and then it is the disturbed shade of the podocyte. And if you translate, what is happening is the increase in matrix nodule formation, basement membrane thickening with podocyte problem. So this is the nutshell of all the mechanism along with the risk factor which will lead to diabetic nephropathy. And then what is the histopathology? What is the KW syndrome? Everybody is knowing it that what is KW syndrome. This is the nutshell when the diabetes is affecting the kidney. It is a Campbell-Steele-Wilson syndrome, and these are the different. Look at it. Green is in the form of the glomerulosclerosis. The thickening of the basement membrane is the blue arrow, and the hyalinosis is the blue arrowhead. So this is three things are present in one slide, but you see one by one. Basement thickening, nodular formation. So this all leads to the staging, and stage 1 is when it is more than 90 is the eGFR, and stage last is when it is less than 5, and in between there are 2, 3, 4, 5, and 3A, 3B is the classification. So this is the basis when we start our treatment, when we give our medication, and we see the prognosis in people with diabetic kidney disease. So this is the nutshell what happened. So what are the clinical features? Clinical features क्या होते हैं? कुछ ये मैं पीजी आदमी से बताएंगे इनके डायबिटिक किडनी के जी एन्यूरिया होता है क्या होता है जी प्रोटीन यूरिया होता है तो प्रोटीन यूरिया इज अ गुड सिम्टम बट इज अ सिम्टम और अ साइन ये साइन से भी बढ़ गया सिम्टम से भी बढ़ गया लैब में चला गया जी most of the people of diabetic kidney disease they are asymptomatic particularly in the initial part of the course और वो हमारे प्रोफेसर साहब कहा करते थे ਤੁਹਾਨੂੰ ਪਤਾ ਉਦੋਂ ਚੱਲਦਾ ਜਦੋਂ ਪਨਵਾੜੀ ਵੀ ਦੱਸ ਦਿੰਦਾ ਹੈ ਬਿਕੋਜ਼ ਪੀਪਲ ਵਿਲ ਬੀ ਟੈਲਿੰਗ ਅਸ ਕਿ ਜੀ ਮੇਰੇ ਤੇ ਪੈਰਾਂ ਤੇ ਸੋਚ ਹੀ ਮੈਂ ਕਿਡਨੀ ਵਾਲਿਆਂ ਨੂੰ ਦਿਖਾਣ ਚਲਾ ਗਿਆ वो तो फिर तो मतलब पनवाड़ी रेडी वाला भी बता देगा ना या वो कहता है मेरे पेशाब पे झग बहुत आ रहे सन so at that time the things have gone away so most of the time it is asymptomatic particularly initially or when complications are there then you can have चाहे इसको edema है या उसको anemia है या loss of consent so this should be in our mind this should be the message that it is asymptomatic oh yaar ye bahut तेजी चल रही है यार ये पीछे ये इसके सिम्टम्स से ये बताना था कार्टून दिखाना था लेकिन ये कार्टून भी इंपॉर्टेंट है and as I told earlier that diabetic kidney disease starts at the start of the type 2 diabetes and in type 1 after 5 years of the disease. When you talk about management we already know that 88% cases it is asymptomatic. So it is the protein urea, albumin urea which you must be going for. And albumin urea is there, but GFR is lagging behind that albumin urea. That's why albumin urea is important to note earlier, and it is the earliest test we should be performing before the EGFR. So you look at it.